an interesting discussion, and a number of things came out. First of all, we looked and talked a bit about libraries, and the library service is being sort of helped enormously by volunteers. We think that's great, but libraries are also more than just a place for books. They're a place where they're an information point, and they're often a place where IT services are available. We weren't sure whether the volunteers were always had an adequate skills to be able to support that. And so we also feel that the libraries could be an important point for other sorts of information. We felt very strongly that the arts as a whole could do with a community board or a community website, and this could be something that would be perhaps available there at libraries too. We talked a bit about sports and leisure facilities, and the feeling there is that any development that takes place, particularly in the Crown Estates, we would like there to be an encouragement for sports facilities to be a part of that development. There's been some loss of sports facilities, and we also wondered if there could be an audit of sports activities in primary schools. When it came to thinking about the local entertainment and cultural facilities, although we don't have an arts centre, we feel there is actually a lot of arts activity that takes place here, and there is a shortage though of things like rehearsal space and changing rooms. And I didn't know this, but apparently there's another floor here, which I have this on good authority, and we wonder if there's an opportunity to develop that, because there's also a lack of exhibition space for art exhibitions. These things are very costly at present, that we don't have enough facilities for them, so we wondered if there was an opportunity to develop that. That would also cover the lack of meeting space, because there's a problem with meeting space now. We've lost the Castle and Ball meeting room, and although there are meeting rooms, there's not very much space. So we feel that we would also like to know what facilities there are in the area for meeting. We also feel that the loss of the Tourist Information Centre has been quite critical in terms of, it covers two areas. It covers our area, which is the Tourist Information Centre would be a way of promoting the arts and letting people know what's going on, but it also feeds into the economy as a whole, because that would be a place where people could find information about accommodation, what was on in the area, and that the loss of that has been quite important. And again, it feels like the library could be a possible centre for that. Thank you.
A lot of areas under health and well-being. The first thing that actually came up was, we're all very worried about the future and obviously how the new healthcare service is going to work in clinical commissioning groups. The one thing that I have learned this evening is that there is a plan on the table for the clinical commissioning groups within Wiltshire to join together and possibly make one large clinical commissioning group that will not be Wiltshire PCT, but will be one clinical commissioning group so that they will be able to be managed from one centre, but each clinical commissioning group within their own right will be looking after their own areas and feeding in. And it does seem to be quite positive at the moment. GPs are very happy that they will be able to feed in far more adequately. We went on to talk about the friendship group within Marlborough. This is definitely part of a big society for us. But they are dealing in 2 hours a week with quite a problem. And there really is a need for a lot of support, possibly more professional support. They're trying to deal with problems that maybe all of us would find difficult, and they're dealing with people that simply fall through the net. They don't necessarily have a diagnosis of anything in particular, but they have got problems, and they become socially isolated. And the Friendship Club is one of the ways that is actually seeking to integrate them more into society again. 2 hours a week is not very much. And I think the message that comes out of this is they're very happy to continue doing what they're doing. There's no way that they're going to stop what they're doing, but they do need support professionally. They need someone to think about funding for them, because there is only so much that you can do. Health checks we went on to, particularly for men, and what came out of that was the action needed was possibly a change in the use of our language. So instead of health checks, we thought maybe fitness checks, and inviting men to see how fit they were was possibly one of the ways in. There are letters going out in the community inviting everyone to come for a health check, but maybe the fitness checks could be carried out or promoted in the workplace, in the sports clubs, in the pubs, wherever you find men. The last table that we covered really only one subject. We really majored on children and, again, mental health problems and problems within the family. So lots of different issues that need addressing through health and education. And what came out of that discussion was quite interesting. We had a lot of professionals on the table, and they were actually giving news of what was happening in their own area of expertise to each other. And they actually didn't know what was happening in each other's area. So there's this whole communication problem again. It would seem in this age of communication, our emails are coming in thick and fast, and information comes across our computers all the time. But actually, targeted information, and we said, well, how can we actually achieve better information sharing with people that maybe we're not always thinking about sharing our information with? And someone said, well, evenings like this, of course, because we've just shared all the information. We've just learned so much in 15, 20 minutes. So there was one wonderful idea that I really liked that came out of that, was how about a sort of professional speed dating evening, where you're just literally moving around and sharing the information, what you're doing with other people, so that you're actually getting it out there. It's always easier, I think, to put a face to the activities that are going on. And that's a really interesting way of doing it. We found the same thing at the health fair. A lot of the public came in, yes, but I think a lot of what came out of the health fair that was held in Marlborough was the professionals maybe met each other for the very first time. They are all, of course, very, very busy people. They are not going to want to give up evenings very often in order to do health professional speed dating. But an event maybe like that, once a year, twice a year at the most, perhaps we should be thinking more about face-to-face contacts and possibly less about the emails that are coming across our computers and possibly are getting deleted, and the information that isn't actually getting out there. Because at the end of the day, this is really going to help patients, families, people in the community. Thank you very much.